Welcome to the Psychology and Physical Training channel. Have you ever wondered how common eating and sleeping disorders really are in our society? The statistics shows 770 million people worldwide struggle with eating disorders. Let's pull back the curtain on this, as it's more widespread than many of us realize. Looking at eating disorders first, research indicates that globally, about 1 in 10 individuals will struggle with an eating disorder at some point in their lives. That's roughly 770 million people, an astonishing figure when you stop to think about it. These disorders, which include anorexia nervosa and bulimia, know no boundaries. They affect people of all ages, from all walks of life, regardless of gender or socioeconomic status. They're not just a phase or a diet gone wrong. They're serious, life-threatening conditions that require professional help. But it's not just eating disorders that are alarmingly prevalent. Sleeping disorders, too, are a major concern. It's estimated that around 30% of the adult population globally experiences some form of sleeping disorder. That's over 2 billion people dealing with issues like insomnia, sleep apnea, or narcolepsy. Sleeping disorders are not just about feeling tired. They can lead to serious health complications like heart disease, diabetes, and depression. They can affect your quality of life, your work, your relationships. Like eating disorders, they too can strike anyone at any time. So why is it important to understand the prevalence of these disorders? Well, awareness is the first step towards addressing the problem. The more we know about these disorders, the better equipped we are to recognize them, not just in ourselves, but in those around us. We can combat the stigma, encourage those affected to seek help, and support them in their journey towards recovery. Now that we know how common these disorders are, let's delve into the different types. Dissecting eating disorders. Eating disorders are complex and often misunderstood. So what are they exactly? At their core, eating disorders are serious mental health conditions that involve intense preoccupations with food, body shape, and weight. They often lead to dangerous eating behaviors and have the potential to be life-threatening if not addressed. Let's delve into the different types of eating disorders. Firstly, we have anorexia nervosa, typically characterized by an intense fear of gaining weight, a distorted body image, and self-imposed starvation. Individuals with this disorder may see themselves as overweight, even when they're dangerously underweight. This can lead to severe health risks such as bone thinning, heart damage, and multi-organ failure. Next up is bulimia nervosa. This disorder involves recurring episodes of eating large amounts of food, followed by behaviors to prevent weight gain, such as forced vomiting, fasting, or excessive exercise. Unlike anorexia, those with bulimia may maintain a healthy or slightly overweight body mass. However, this doesn't make it any less dangerous. The recurrent binge and purge cycles can affect the entire digestive system and lead to electrolyte and chemical imbalances in the body that can affect the heart and other major organ functions. Lastly, we have binge eating disorder. This is characterized by frequent and uncontrollable consumption of large amounts of food. Unlike bulimia, periods of binge eating are not followed by compensatory behaviors, making individuals with this disorder often overweight or obese. This can lead to heart disease, high blood pressure, diabetes, and other health problems. Each of these eating disorders is unique in its symptoms and health risks. However, a common thread is the severe distress and concern about body shape or weight and the dangerous eating behaviors that result. It's also important to note that these disorders are not a choice or a lifestyle decision, but serious, often debilitating mental health conditions. With this understanding of eating disorders, we can now explore their causes. Unraveling the causes of eating disorders. The causes of eating disorders are multifaceted. They're not just about food. A truth that may seem contradictory at first, but when we delve deeper, the complexity of these disorders becomes evident. Eating disorders are often seen as a consequence of individuals' struggle with self-identity and self-worth. They're not simply a choice or a phase someone is going through, but rather a manifestation of deeper psychological issues. Let's start with genetics. Studies have shown that individuals with a family history of eating disorders are more likely to develop one themselves. This suggests a genetic predisposition, much like we see with other mental health conditions. However, genetics alone can't explain why these disorders develop. Now consider the environment. We live in a world that often equates thinness with beauty, success, and happiness. This societal pressure can be a catalyst for those predisposed to eating disorders. It's not uncommon for these disorders to begin after a period of dieting or in response to a life event that causes stress or trauma. And let's not forget the role of psychology. Eating disorders often coexist with other mental health conditions like depression, anxiety, and obsessive-compulsive disorder. They can be a way to cope with negative emotions, to gain control when everything else seems chaotic. We also can't overlook the impact of media and unrealistic beauty standards. From a young age, we are bombarded with images of perfect bodies and are taught to aspire to these often unattainable ideals. This can lead to body dissatisfaction and can trigger disordered eating behaviors. It's important to remember that these are just risk factors, not guarantees. Not everyone exposed to these influences will develop an eating disorder. It's a combination of many factors, a perfect storm, if you will, that can lead to the development of these complex disorders. Eating disorders are a serious issue, but so are sleeping disorders. Let's delve into that next. Having understood the causes of eating disorders, we'll now navigate through the labyrinth of sleeping disorders, another critical aspect of our mental health. Unmasking sleeping disorders. Sleeping disorders are more than just a bad night's sleep. They can have a significant impact on our health and daily life. Let's delve deeper into what sleeping disorders really are. These are conditions that disrupt an individual's sleep patterns on a regular basis. It's not about one or two restless nights, but rather a persistent difficulty in falling asleep, staying asleep, or achieving restful sleep. There are several types of sleeping disorders, each with its own unique set of symptoms and health risks. Let's start with one of the most common ones, insomnia. This is characterized by a chronic difficulty in falling asleep or staying asleep. It's like being caught in a cycle of fatigue, where your mind wants to rest, but your body simply doesn't cooperate. Over time, chronic insomnia can lead to a host of health issues, including depression, heart disease, and diabetes. Next, we have sleep apnea, a disorder where breathing stops and starts repeatedly during sleep. It's like trying to sleep while someone intermittently holds a pillow over your face. Quite unsettling, isn't it? This repeated disruption in breathing means the brain and the rest of the body may not get enough oxygen, leading to serious health risks such as high blood pressure, stroke, and heart failure. Lastly, let's talk about narcolepsy. This is a neurological disorder that affects the control of sleep and wakefulness. Imagine feeling an overwhelming urge to sleep during the day, or suddenly falling asleep without warning. It's as if someone flips a switch and you're out. This can be particularly dangerous if it happens while you're driving or operating machinery. These are just 3 examples of sleeping disorders, but there are many others. Each one can significantly affect a person's quality of life, mental health, and physical well-being. Understanding these disorders is the first step. Now let's discuss how to recognize them. Recognizing the signs. Recognizing the signs of these disorders in ourselves and others is crucial for early intervention. Let's dive into the signs and symptoms that might indicate the presence of an eating or sleeping disorder. With eating disorders such as anorexia nervosa and bulimia, you might notice a preoccupation with body size, weight, and food. There might be extreme dieting, secretive eating, or an unusual amount of time spent exercising. Physical signs can include sudden weight loss or gain, feeling cold even in warm weather, or a disrupted menstrual cycle in women. Sleeping disorders, on the other hand, can manifest in various ways. Insomnia, for example, might involve difficulty falling asleep, staying asleep, or waking up too early. Hypersomnia, or excessive sleepiness, might result in prolonged nighttime sleep, difficulty waking up, or frequent daytime napping. Sleep apnea can cause loud snoring, gasping for air during sleep, or momentary pauses in breathing. But why is early detection so important? Well, the sooner these disorders are identified, the sooner appropriate treatment can begin. Early intervention often leads to a better prognosis and can significantly reduce the risk of serious health complications. Now, If you're wondering what to do if you or someone you know might be experiencing these symptoms, let me assure you, there are resources available. Mental health professionals, such as psychologists, psychiatrists, and therapists, are trained to diagnose and treat these disorders. Many communities also have support groups where individuals can share their experiences and find comfort in knowing they're not alone. Online resources like reputable health websites and virtual support groups can provide valuable information and connection. It's important to remember that it's okay to not be okay. It's okay to ask for help. These disorders are treatable and recovery is possible. There's no need to face these challenges alone. Reach out, seek help, and take the first step towards a healthier future. Remember, it's okay to ask for help. These disorders are treatable and recovery is possible. And if you like this video, do not forget to subscribe to the Psychology and Physical Training channel for more videos. Thanks for watching.